Paced breathing is a powerful emotion regulation strategy used in dialectical behavior therapy. There's a lot of research showing that breathing really slow, about 6 breaths per minute, can strongly regulate our emotion physiology, especially when we do a lot of it and thoroughly build it up as a solid skill. This way of breathing maximizes the activation of the parasympathetic nervous system, which is the body's physiological emotion regulation response, opposite to the fight or flight response. You may have gotten advice to take a few deep breaths when you are feeling upset, which may help to some degree, but thorough breathing training makes paced breathing much more effective. This video focuses more on what to do and much less on theory. If you prefer, you can watch the longer version of this video that much more thoroughly covers the underlying physiology and how paced breathing works. Paced breathing is one example of the DBT principle called opposite action, which is one of the most powerful ways to improve overall emotion regulation. It's based on a solid body of research showing that behavior change is a really powerful way to change thoughts and emotions. Acting opposite to our emotions can improve how we think and feel when our emotional reactions do not fit the situation, are excessive, or are not effective. The large box here shows that the internal experience of emotion, the physiology, feelings, and urges, causes emotion behaviors, and also that emotion behaviors influence internal emotional experiences. We feel how we act, and we act how we feel. Here you see how feeling anxious or upset makes us breathe faster, and it is also true that when we breathe excessively fast and shallow, it increases our anxiety and distress, and inhibits parasympathetic activity, which makes the fight or flight response dominate. If we breathe like a person who is upset or unable to tolerate a situation, then that will be our reality. When we are physiologically regulated, we breathe slowly and smoothly. When we breathe like a person who is regulated, we activate the parasympathetic nervous system and will eventually become more regulated, meaning we'll be less emotionally triggered or able to recover more quickly. The same opposite action principle works for many other emotion struggles like depression. When we feel depressed, we isolate, avoid, and give up. And acting like a non-depressed person helps reduce depression eventually. When doing paced breathing, it is crucial to make sure that you are breathing slowly enough. But when trying to do slow breathing, most people don't breathe slowly enough on their own until they complete the breathing training. First, you need to figure out how slowly to breathe. Breathing close to 6 breaths per minute is the most effective for the average person. If you have trouble breathing that slowly, just do your best to get as close to 6 breaths per minute as you can. Breathing slowly gets easier with repeated practice. It is even more effective to breathe at your resonance frequency pace, if you know it, to maximize your parasympathetic activity. Your resonance frequency is the breathing pace that achieves optimal physiological regulation for you, when your breathing rhythm matches your heart rhythm, and you maximize breath-to-breath heart rate fluctuations. This heart rate variability involves each exhale slowing heart rate to the greatest extent possible, followed by heart rate increasing during the inhale. In this state, your breathing and heart rhythms are said to be resonating, which signals safety to your brain to get you out of the fight or flight mode. Resonance pace varies among individuals. It may be 7 breaths per minute for you, but 5 breaths per minute for another person. A trained biofeedback therapist can use biofeedback equipment to determine your resonance pace. And until you can do that, it is probably best to make 6 breaths per minute your target pace, since that is the resonance pace for the average adult. On average, women and short people need a slightly faster pace, so they can select 6.5 breaths per minute. On average, men and taller people need a slightly slower pace, so they can select 5.5 or even 5 breaths per minute, whatever is the most comfortable. Here's another view of synchrony between breathing and heart rate when a person breathes close to 6 breaths per minute. The balloon indicates the lungs filling and releasing air when a person breathes in and out. Listen to the sound of the heartbeat and how it speeds up when the lungs are filling and slows down when the lungs are emptying. An effective way to learn to breathe near your resonance frequency pace is to do heart rate variability biofeedback. If you don't have access to a trained biofeedback therapist, there are a variety of affordable options for simple biofeedback equipment that you can connect to your smartphone or your personal computer. Heart rate variability biofeedback involves seeing in real time your moment-to-moment heart rate fluctuations, which provides immediate visual feedback about how effective each exhale decreases your heart rate. And this feedback helps you improve your effectiveness, which really means it gets you to slow down to your best pace. Here's a look at heart rate fluctuating from moment to moment when the person is feeling stressed at the start of a biofeedback session. Now you see heart rate fluctuations when a person slows their breathing to their resonance pace, almost 6 breaths per minute. And now there is even more heart rate variability. As the person slowly exhales, the heart rate slows down, the slowest beating at the end of the exhales, and now the person is becoming more regulated. The simplest way to make sure you are breathing at your target pace is to use a breathing pacer. Most pacers are sounds or things to look at that prompt you when to inhale and exhale. On my website you'll find a variety of breathing pacers, including MP3 audio files that you can save to your computer or your phone. To get them from my website, click on Current Clients and scroll to the bottom of that page. Here are the breathing pacers, and here are the options for biofeedback equipment. With the audio pacers you're about to hear, you match your inhale to the first segment of sounds, usually in increasing pitch, and you match your exhale to the second segment of sounds, usually decreasing pitch. The balloon image will show you how to do this with the guitar and flute pacers. As the balloon inflates, breathe in. As the balloon deflates, breathe out. And you'll notice this way of breathing corresponds to the changes in pitch of the guitar and flute sounds. Once you understand how to do this, you can close your eyes and simply follow the sounds in this way. If you don't like the sounds, you can turn off the sound and match your breathing to the balloon. There are also various YouTube videos that you can watch to pace yourself in a similar way. Breathe in. Breathe out. Breathe in. Breathe out. This is a really large amount of heart rate variability. 100 beats per minute at the end of the inhales and 60 beats per minute at the end of the exhales. At this slow pace, each exhale slows the heart rate by 40 beats per minute, which is much more slowing than when this person breathes faster. Don't expect to achieve as much heart rate variability as this person, who is showing the best possible resonance for a 20-year-old elite athlete. Just try your best, the more the better. Here's an overview of the specific ways to do paced breathing effectively. Breathe at your target pace, your resonance frequency if you know it, 6 breaths per minute if you don't. Many breathing experts recommend you breathe from your lower abdomen rather than from your chest. You can place one of your hands on your abdomen and one on your chest to make sure that during your paced breathing your abdomen is moving but not your chest. Make your exhale longer than your inhale. For example, 4 seconds in and 6 seconds out. It is sometimes helpful to purse your lips to slow down the exhale. When you purse your lips at the start of your exhale, you tighten your lips to make the opening smaller, which means you release the air more slowly. It also creates this sound. And if you focus your attention on this sound, it can help you stay focused on your breathing. Keep your attention on your breathing so that it doesn't as easily drift to disruptive thoughts. One way is to count 4 seconds on the inhale and then count 6 seconds on the exhale. Breathe slowly for at least 5 straight minutes, preferably 10, which will often help you much more than if you do it for only a minute. Be patient and focus on effective coping. In many intense situations, it is unlikely that you will notice much of a difference after a few minutes of paced breathing, and you may not feel better even after 10 or more minutes. The most likely outcome in these intense situations is that you will tolerate your emotion much better and get through the situation skillfully without making it worse. Now that we've reviewed how to do paced breathing, let's turn to the big picture, further clarifying what we want you to get out of this breathing training overall, why you should put in the time and effort to master this skill. The first goal of emotion regulation breathing training is to increase your ability to recover from emotion triggers. If you do your resonance frequency paced breathing after a dysregulation episode begins, you can more quickly restore parasympathetic activity, which may result in feeling better sooner after you are triggered. But more likely you will learn to better tolerate your emotions or more effectively handle the situation. When emotion episodes get triggered, parasympathetic activity reduces, which reduces us to simplistic survival thinking. Restoring parasympathetic activity restores your cognitive abilities, which can help you figure out effective problem-solving or coping options. Increasing parasympathetic activity will probably also increase your ability for sustained effort, increasing your willpower, so to speak. The second goal of breathing training is to reduce vulnerability to emotion triggers by increasing parasympathetic activity in general, even when not trying to regulate. Soon after a full session of paced breathing, you will be likely to have a smaller emotion dysregulation episode following a trigger. The episode will probably be less intense, briefer, or less disruptive. If you spend enough time breathing near your resonance frequency, your improved heart rate variability will linger further past the sessions of practice, a lot like when you generally feel better when you have a regular exercise routine. At a minimum, people with severe emotional reactivity may need at least 15 minutes of resonance frequency breathing, at least 4 days per week, for at least 10 straight weeks. But more research is needed to confirm the exact amounts needed. It may be that even more is needed to see noticeable improvements in emotion resiliency. Breathing training done thoroughly likely needs to progress through a series of stages, and you may have trouble succeeding at the final stage, recovering from triggers, if you have not accumulated a solid foundation of practice at the earlier stages. To start, it's useful to use biofeedback equipment to determine your resonance frequency, the breathing pace that achieves optimal physiological regulation for you. Remember, resonance frequency varies among individuals. It may be 7 breaths per minute for you, but 5 breaths per minute for another person. While connected to biofeedback equipment, you can breathe at various paces between 7 breaths per minute and 5 breaths per minute, and a trained therapist can directly observe your heart rate variability and see which pace creates the largest possible heart rate variability for you. To do this, your therapist can go to my website to download the full range of breathing pacers and find biofeedback equipment. Until you find out your resonance frequency pace, just practice breathing at 6 breaths per minute. And if you have trouble breathing that slowly, just do your best to get as close to 6 breaths per minute as you can. Breathing slowly gets easier with repeated practice. It is also useful to measure your heart rate variability at the start so you can later determine how much progress you have made regulating your emotion physiology. At the end of your training, do you have more heart rate variability while at rest? Do you show even bigger improvements in heart rate variability when you attempt to calm yourself compared to when you started? Next, you need a lot of practice breathing at your resonance frequency pace with a pacing stimulus or biofeedback equipment. My website has options for audio pacers, including MP3 files that you can download to your computer or your phone. There are also various YouTube videos that you can watch to pace yourself. In one of my videos, you match your breathing to a balloon inflating and deflating. You can practice with heart rate variability biofeedback with the help of a biofeedback therapist, or by using simple equipment that you can put on your personal computer. The links to a few biofeedback options are available on my website. Heart rate variability biofeedback involves seeing in real time your moment-to-moment heart rate fluctuations, which provides immediate visual feedback about how effective each of your breaths is in decreasing your heart rate when you exhale. Next, you need to practice without relying on breathing pacers, since you will not always have access to your pacers. This type of practice will help you be better able to breathe at your resonance frequency pace in the broadest range of situations. One main way to do this is to frequently practice with my 10-breath pace test. This practice involves timing the duration of 10 of your full breaths when you are trying to breathe at your resonance frequency pace. The duration tells you if you are breathing too slow or too fast, and you use that feedback to try again to get even closer to your target pace. Watch my other video to see a full description and demonstration of the 10-breath pace test. As needed, you can count yourself as you attempt to master this task. Finally, you need a lot of practice breathing at your resonance frequency pace in challenging situations to achieve the highest level of skill. Try to frequently practice paced breathing soon after triggers naturally occur. It is also extremely useful for your therapist to help you practice regulating with triggers in your therapy sessions, which is sometimes done during exposure therapy. I hope you give this full paced breathing training a try and that you find it helpful. And these skills don't usually build quickly and easily, so I hope you're patient with yourself in the process. Please let me know if you have any feedback for this video.